With news of the COVID-19, commonly known as the coronavirus outbreak, changing rapidly, I wanted you to hear from me and my team about the steps we are taking to keep our city healthy and safe. The City of Lynn, including the Mayor's Office, Public Health Department, Office of Emergency Management, and first responders are in communication and working with the Mass Department of Public Health concerning COVID-19. There are currently no confirmed cases of COVID-19 coronavirus in the City of Lynn. The Lynn Public Health Department is monitoring patients that have been contacted by DPH as someone who has been exposed to a confirmed case of COVID-19. The city has been preparing extensively to prepare for scenarios that can play out with the evolving COVID-19 situation. We will continue to provide regular updates on the city website, social media, and the Smart 911 emergency system. I want you to know that we are taking all necessary steps to potentially prevent the spread of COVID-19 here in the City of Lynn. And here's what we are doing. Residents are encouraged to conduct their business with City Hall by phone or online as much as possible. All non-essential, in-person governmental meetings and large group gatherings will be postponed, suspended, or canceled, or they'll be able to be held virtually. They will be held virtually. All residents and private entities are advised to refrain from holding any unnecessary large gatherings to reduce community spread of COVID-19. And we thank those community organizations who have already taken action in this regard. The Lynn Public Schools will be closed until March 27th. We ask parents to have child arrangements in place through April 17th. Grab-and-go lunches will be available for students daily between 11 a.m. and 1 p.m. at the selected schools: Marshall Middle School, Lynn English High School, Lynn Classical High School, and Lynn Tech High School. School resources will be made available to students by grades on the Lynn Public Schools website. We highly encourage students to access these resources every day. They will be available, and we want to make sure that you access them. All schools will be open for students and staff to receive their personal items on Monday, March 16th, next Monday, from 8 a.m. to 1 p.m. The Lynn Auditorium shows are postponed through April 29th and will be rescheduled at a later date. Please continue to follow the city's website and my Facebook page, Tom McGee, Mayor of Lynn, for official information on the city's response to COVID-19. We update that daily, and we continue to put relevant information, and this is an evolving situation, so that information continues to change, and the information that's relevant and continues to be relevant will continue to be part of that messaging, and it will be on our website. The CDC has said that high-risk populations, including older adults and people with serious chronic medical conditions such as heart disease, diabetes, or lung disease, need to be aware of these information and the facts to help them stay safe. The CDC recommends that the residents who fit these criteria should take everyday precautions to keep space between themselves and others, limit close contact with those who are sick, and to avoid crowds, cruise travel, and non-essential air travel as much as possible. We want residents to know, after speaking with numerous nursing homes in the city and being in continuous contact with them, there are significant visitor restrictions in place to protect those elderly that are living in those nursing homes. Unfortunately, widespread coronavirus testing is still not available, and we're all pretty frustrated with that. And all testing at this point still needs to be approved by the Mass Department of Public Health, and that is causing a lag in both testing and diagnosing. So I think that's important to note. You can follow the national news in terms of what's happening there, but that testing is, again, is not readily available. We are working hard to ensure that those tests will be more available, but we're depending on the federal government to step it up and make these tests available so that we can ensure that those that need the testing in Lynn will get the testing in Lynn. But again, right now, that is not the case. State and federal health officials are encouraging residents to take the following precautions, similar to those who may have symptoms for the common cold, flu, or respiratory viruses. Wash your hands with soap and water, and wash those hands, and I'm sure you've heard it every day on the news, at least 20 seconds. Make sure you're doing it right and keeping your hands clean. That's one of the key pieces in ensuring that you can prevent the virus from spreading if it is you've been exposed or you've had it on your hands. Cover your coughs and sneezes with your elbow or a tissue. Dispose of any unused materials immediately after you've used them. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home if you are sick. That's an important thing. If you're feeling sick, stay home. Call your doctor and give them the kind of symptoms you're facing so that they understand where you're at. But if you're feeling sick, you have any kind of symptoms, you need to stay home. The Center for Disease Control released new recommendations for recent travelers from the following countries: China, Iran, Italy, South Korea, and most of Europe. Anyone who has traveled to or from these countries is advised to self-quarantine for 14 days since they left the affected area and take the following recommendations. Again, that's for 14 days. Take your temperature with a thermometer 2 times a day and monitor it for fever. Also watch for cough or trouble breathing. Stay home and avoid contact with others. Do not go to work or school for this 14-day period. Discuss your work situation with your employer before returning to work. Do not take public transportation, taxis, or ride sharing during the time you are practicing social distancing. Avoid crowded places such as shopping centers and movie theaters, and limit your activities in public. Keep your distance from others from 6 feet or 2 meters. And again, we're spaced out here. We're reflecting that social distancing. It's important to understand that, and it's important to make sure that you follow the recommendations. And again, I want to encourage all residents to visit the City of Lynn Health Department Coronavirus Resources page at www.lynnma.gov. Again, www.lynnma.gov/coronavirus for more information, and to sign up for the Smart 911 updates at smart911.com. Again, that's an important part of this. The more people that sign up, the more information we can make available, and you'll get instant updates, texting, emails, and other options that you can choose. But as information changes and important information is available, you will immediately receive texting sometimes is the best way. It pops up on your phone and you can see that. And again, we're using that for the kind of important information that you need to know as we move forward. And we're not using that for every bit of information. It's the most important information that you'll receive those contacts on. For other information, clearly the city's website, as we continue to update it, there's a number of links there that brings you across a broad range of informational opportunities to take a look at that, understand what we're doing, understand the kind of information you need to protect yourself and your families. And again, this is all of us working together to try and make this happen. And finally, before I turn it over to members of our emergency management operations team, I want all Lynn residents to know we are united in our efforts to prevent the spread of COVID-19. This is an evolving situation, and we ask your patience and understanding as we deal with this truly unparalleled situation for our community and for our country. We will do our best to keep you informed and advised of all developments. And again, I want to thank all of you for partnering with us on this effort. This will be a team effort from our perspective, from the emergency management team, all of the city employees, the police and fire, but just as importantly, all of us in this community that call City of Lynn our home, that we all come together and work together to get us through this continuing crisis. So again, I want to thank you all for listening, and we will continue to update you and work together as this evolving situation continues to shape what decisions we're making moving forward. With that, I would like to ask Deputy Superintendent Dr. Tutwiler to come forward and maybe give some brief explanation on the school closing that we made a decision on, a little bit of background on that, and give a little more information related to what that means and what will happen moving forward. Dr. Tutwiler.
So the mayor did a really nice job explaining or describing the situation as rapidly evolving. It's also provided a framework for the school closure. Schools are closed until March 27th. I would only add that given the nature of the situation, we decided yesterday afternoon to cancel all classes today to allow staff to come together and work in teams to create online content that students and families can leverage during the 2-week closure. It will be by grade and available for families on their school's website. We're also assembling a set of resources for families to support the social and emotional needs of their students during the closure. Mayor's already spoken to the situation regarding lunch. We will be offering that Monday through Friday, 11 to 1 at 4 sites: English, Classical, Lynn Tech, and Marshall. I would just say that, again, this is a situation for which no community really has a playbook. But I applaud the efforts both of the team that the mayor's assembled, but also the Lynn Public Schools team, and very quickly, and I think in my opinion very substantively, coming up with a plan to keep students and staff safe first and foremost, but also meet their needs during the closure. So I just want to reiterate one point. On Monday, between the hours of 8 and 1, any student who has a personal item that they want to retrieve, the buildings will be open for that. And the nurses will be there as well if there's medication that a student needs to retrieve in partnership with their parent. That's it.
Great. Thank you. Thank you, Dr. Tutwiler. And as you can see here, we have some hand sanitizer, washing hands, hand sanitizer. I know it's a little bit tough to get right now, but if you can get it and use it as we are, it's important as well. I'd like to ask Paul Rickey to come forward and give a little bit of a background on the emergency management team. We have a great, I just want to say, we have had a great team, a great group of people. We've been working on this for a while, and without their efforts and the teamwork we have, as you see, some of the team here, but it's a much broader range. The chiefs of police and fire and many others that are a part of this team have been doing a great job and keeping track of this. It's changing by the hour sometimes. Every day it's different, but sometimes it's changing on the hour. Yesterday was a pretty newsworthy day. A lot of things changed over a short period of time. So I'd like Paul to come forward and give a little background on what the team is doing and how long we've been working on this. And again, Paul and Tom and the whole team have been doing great work. So, Paul?
Thank you, Mayor. My name is Paul Rickey. I'm a lieutenant at the Lynn Fire Department Office of Emergency Management. We've been following this situation for over a month now, as it's progressed. We came to a point a couple weeks ago where we saw that we were in a possible community spread type situation following what was going on in the West Coast. And we activated our emergency management structure. As the mayor pointed out, Dr. Tutwiler pointed out, kind of almost an unprecedented situation. We haven't dealt with this in years, at least not as my tenure as emergency management director. So our main role with emergency management is to provide a conducive environment for the mayor and all the department heads, the mayor, public safety, superintendent of schools, all the impacted departments to make decisions and to support those decisions. We do that through a policy group, which is made up of the city department heads who makes strategic decisions, and our coordination group, kind of the boots on the ground personnel who make things happen. And so far, even though it's a very different situation, the communication's been fantastic. The mayor gives us a lot of support, and that can be unusual in some communities. Emergency management, sometimes they manage by crisis. This community, we haven't been managing by crisis. We've been managing using a structure that has actually been in place for a few years. Actually started by the Deputy Director, Tom Hines, who kind of laid the foundation for this. So we're here to support any decisions that the policy group needs to make, and we're going to keep working on this in the days to come, and we're doing this full time right now. So that's all I have to say.
Great. Thanks, Paul. Thank you, Paul. And I'd like to bring up next Dr. Paczynski, who is with our medical team. MJ, Michelle Damaris, the head of the health department, and Dr. Paczynski have been giving us the important information on the medical side. As all of those details come down from the CDC as well as DPH, we're working closely with both those agencies to ensure the information we're getting out is accurate. And I know that there's a lot of information that's out there. I would just ask people, if you want to get the facts, the facts related to any of the questions you have, it's on our website with many links to CDC, DPH, and other places. You can get the real accurate information on what's happening day to day. It's important that you reach out and look at that information, because that's where you can get the straight story. And with that, I'd like to ask Dr. Paczynski to come forward and say a few words.
Thanks, Mr. Mayor. In agreement with everybody else has said, we've been working well together on the emergency operations team. And I'm the Chief Medical Officer of the Community Health Center. Right now, we've seen it's been less than 10 patients who were persons under investigation that we deemed when they came in. We would do testing if we could. And the protocol thus far has been to contact DPH, and of that number, we were able to test one, and we're waiting for that result. So as the mayor alluded to, one of the challenges has been getting the available testing and getting the results back. So DPH is working on that. There's correspondence, it was probably about an hour ago, that they've loosened the restrictions on how readily we can test, but there's still a challenge for the companies that are rolling that out. It started more on the West Coast, and it's coming to the East Coast. So we will be able to start testing soon, but it could still be a matter of weeks. As people know, there's no treatment, and as this is a pandemic, we're in the phase of mitigation, meaning we're trying to limit large groups together. We're doing that at work. As well as we're paying attention to our high-risk patients and either trying to do telemedicine with them over the phone and have them come in later and seeing only urgent patients or patients that may be at risk for COVID-19. Thanks.
Thank you, Doctor. With that, we'd be happy to take a couple of questions.
Sure. So just to confirm, there's been one person from the City of Lynn that's been tested?
So good question. At Lynn Community Health Center, we've had one. But Salem Hospital, North Shore Medical Center, and other hospitals are now doing testing, even kind of drive-through testing, people have probably heard about.
So do we have an idea of how many
I don't.
residents have been tested? And
I don't know.
okay. But in terms of testing someone, how do you make the distinction of this person should, this person shouldn't? Is it just the lack of available testing, or is it people who have, maybe traveled from somewhere? How does that determination get made?
So there's a protocol the mayor had gone through the countries where people are at risk. That has greatly expanded over this week and will continue to expand. There's symptoms, so fever and cough are the main ones. And then now it's even more expanding as if somebody's been exposed to somebody with known COVID-19. So those are the reasons we think about testing. When we come to a clinical conundrum, we have to ask DPH now, we need to call before we test, right? So if there's a question about that or it's a little bit fuzzy, they'll go through and call us back and let us know. And thus far, it's been one of about 8 or 9.
Do we have any idea how many people in Lynn are on quarantine right now?
There's 9.
None?
9.
9. So 9 right now.
9.
Yeah.
Are these people symptomatic, or have they traveled, or a combination of both?
Some have traveled, some have been close contacts. I keep in touch with them twice a day with temps and give them all the important information that if they become symptomatic, not to just show up at the doctor's office, not to just call 911. You need to let the first responders know that you have been in contact or are having symptoms so that they can prepare appropriately when they arrive.
And is there any protocol in place if someone is confirmed to have COVID-19? And by that I mean measures like indefinitely shutting down schools or closing public transportation, anything set in stone?
We are continuing to get as the information comes in, and we have been meeting to discuss what that would be, and I think it would depend on the circumstances what the action would take. So it's really not something you can answer at this point, but if someone is certified as in the City of Lynn, has been verified to be exposed and has been tested positive, we will make that decision based on the situation. Similarly with those that are are self-quarantining, it's based on a criteria of facts, we would then take all of that information to make the decision on what the appropriate action is for the city to address that. So it's a good question, but I think it depends on the situation. And I think just to follow up on the testing piece, there's a whole set of criteria to then establish the testing that can happen. So again, that's, I think, the frustration from my perspective and our perspective, as well as others in Massachusetts and beyond, is that the testing is very limited. So that criteria is established by DPH through the CDC. As more testing is made available, and hopefully over the next few days, there'll be much more. There's things that are being done to get that testing and make it available. We'll continue to monitor those options as that information and those tests become available.
Is there any heightened concern for Lynn specifically related to the hospital having closed? Does that play into this at all?
It's a great question. I was at a meeting yesterday with a number of mayors and leaders and town managers, as well as health directors in Boston. It was a meeting, and then there's been a number of calls related to that. The reason that a lot of the actions that we're taking and others are taking is to recognize that we want to ensure that the health system can handle, as this continues to evolve, can handle the kind of cases that may come as this progresses. So that is obviously an issue related to how do we ensure that people have access to health care. So we're taking the actions now to help mitigate and minimize that. Again, we will see how that, I think we've done everything we can at the local level, but it's a good question, and I think the larger question, both in Lynn, but more importantly in Massachusetts and across the country, is trying to eliminate the exposure so that as the medical cases occur, that we can handle those cases within the current resources that are available on the medical side. So we'll be working with Lynn Community Health Center, we'll be working with North Shore Medical Center as these cases evolve or as things evolve, and we'll be working to hopefully ensure that the health care is available. But again, that's a larger question related to the issue. So that's why a lot of the decisions we're making, that we're working together on, is related to our ability to try and address this in a way that's really strong, sensible, and rational as we try to address what is an evolving situation. So.
And last question, I guess, could we just get a layman's definition of what community spread means?
Doctor, you want to explain that?
Sure. So community spread would really be that it's from person to person. So right now it's been deemed a pandemic by the World Health Organization. The definition of a pandemic is the rapid spread across the world of a disease that often we don't have immunity to. So it's not that somebody's traveled from a country, that's just the one case, and somebody gets it, it spreads from person to person to person.
Okay.
Does that make sense?
Perfect.
Great.
Thanks.
Great. Thank you all very much. Thank you.
Thank you.
And again, thanks to the team.